Today, I am pleased to report 6,106 Albertans have recovered from COVID-19, leaving 679 active cases in the province. This is the fewest number of active cases in Alberta since March 30th. Of course, we must not forget that this virus is still impacting many people across the province. Currently, 43 people are hospitalized with COVID-19, with 4 of those admitted to ICUs. In the last 24 hours, out of 3,168 new test results, there were 25 new cases. Sadly, I must report that there are 2 new deaths today. I would like to extend my sympathies to all those who have lost loved ones during this time. In the past several weeks, cases of a new condition called multisystem inflammatory syndrome in children, or MISC, have been reported in a number of jurisdictions. It is similar to an inflammatory disease known as Kawasaki's disease and responds to treatments such as steroids. It has been seen in the UK, Italy, Quebec, and the United States. Potential cases are also being explored in other provinces across the country. Today, I am announcing that 1 possible case of MISC is being investigated in Alberta this week. Reported cases across the jurisdictions I mentioned involve children and adolescents with recent infection with the virus, with the syndrome seeming to develop several weeks to about a month after an infection. MISC involves inflammation of multiple organs, including the heart, kidneys, blood vessels, and nervous system. Fever is a key feature of this syndrome, and other symptoms can include rash, vomiting, diarrhea, and abdominal pain. The early information available suggests that the majority of children who have COVID-19 would not be expected to experience this syndrome. However, we are making this disease reportable in order to monitor any cases that might occur and to improve our understanding of this illness. We are developing clear guidelines aligned with global reporting standards in order to support healthcare providers in diagnosing and reporting this condition to public health authorities. I know this new condition might be scary for parents. I worry for my kids too. It is important to remember that this condition appears to be rare and it is treatable. Part of this syndrome is a high fever for 3 days. The child is relatively unwell. Again, they can have a rash and feel unwell. And to be clear, if a child has a high fever, you don't need to wait for 3 days before getting medical attention. So the parent can absolutely take them in. If they need medical care, they can call their family doctor, call 811 if they would like to get some additional advice at home, or take them into the emergency department if they feel that their child is very ill. And so any of those are completely appropriate, and it would depend on the situation and the parent's knowledge of their child and how ill that child is, how concerned they are, whether or not they would go through their family doctor first or 811 or go directly to the emergency department. It is important to remember that this condition appears to be rare and it is treatable. It is, however, a reminder that we continue to learn new things about this virus and that we must continue to be cautious in our relaunch. This is also a good time to look around and remember that we are not alone in Alberta. Other provinces in Canada and the vast majority of countries around the world have taken similar measures to us, with some taking much more stringent steps. As summer approaches, we must not forget that COVID-19 was and is a deadly disease. When we look at the impact of COVID-19 on a global scale, during the peak of global deaths in April, the number of weekly deaths being reported was higher than lung cancer, road injuries, diabetes, or suicide. Even with unprecedented efforts to stop spread, the cumulative global death count so far this year for COVID-19 is higher than what would be expected for year-to-date global deaths from malaria or homicides. Closer to home, while this is often compared to influenza, our current COVID-19 death toll of 142 in Alberta is 1.5 times higher than the highest annual influenza death number in the last 5 years, and we have never taken such measures to prevent influenza from circulating. It is on all of us to look out for one another and protect our most vulnerable from harm. We are still in this fight together. Last weekend, I saw a great metaphor for this while driving with my family. We noticed a slowdown on the road ahead of us and had to stop for a moment without knowing what was happening. When we got closer, we saw two large pickup trucks driving slowly on either side of a median between an exit ramp and the main road. It wasn't apparent until driving by them that they were escorting a Canada goose and her goslings, protecting them from oncoming traffic. I love this image of Albertans protecting the most vulnerable, and the vehicles around them being patient and accommodating, giving them space to get the goslings to safety. The individuals in these two trucks did this not because it was required of them, but because it was the right thing to do. We can all emulate this behavior in our daily lives by considering what we are able to do to make it safer for those around us. It might be inconvenient and even awkward to adjust to measures like wearing masks when we are around others in public, or always staying home when we are sick. But if we remember why we are doing this, that our collective actions are to prevent severe illness and death, we are reminded why our actions matter.